before our presentations today, we would like to dedicate a few moments to recognize the importance of Henrietta Lacks' cells, otherwise known as the HeLa cells, in cancer research and the many other types of human research where they have been used. Mrs. Lacks was a 31-year-old African-American mother of 5 who sought treatment at Johns Hopkins Hospital in the early 1950s for cervical cancer. Unfortunately, treatment was unsuccessful and Mrs. Lacks passed away in 1951. Next slide, please. In the 1950s, researchers collected cells from patients with cervical cancer who were treated at Johns Hopkins Hospital, but cells from patient samples quickly died. It was discovered, though, that Mrs. Lacks' cell multiplied. Her cells have been used in research due to their unique ability to continuously grow and divide in the laboratory. Her cells have contributed to research on the effects of zero gravity in outer space, development of polio vaccine, the study of leukemia, AIDS virus, and cancer. Our understanding of breast cancer is advancing because of our knowledge of cancer genetics, and Mrs. Lacks' cells have continued to inform cancer genetics, leading to improved ways of diagnosing and treating breast cancer. However, in the 1950s, when her cells were being distributed among researchers, there were no established practices for informing or obtaining consent from patients when retrieving cell or tissue samples for research purposes, nor were there any regulations on the use of patient cells in research. As a result, Mrs. Lacks was never asked if her cells could be used in research. Next slide. What happened to Henrietta Lacks in 1951 when the doctors took her tissue for research without her consent would not happen today. Groundbreaking cases like the one of Henrietta Lacks have brought to light the importance of study participant-informed consent. Today, if researchers want to take tissue or draw blood or test new treatment methods, essentially conduct any type of research, federal laws requires informed consent from every study participant. A consent includes information such as the study's objectives, procedures, risks, benefits, and privacy protection. There are also other policies and procedures and offices in place to protect research participants' rights, confidentiality, and safety, such as the Institutional Review Board, Office of Human Protections at Research Centers, and others as listed in this slide. Next slide. While Mrs. Lacks did not voluntarily contribute the tissue that was used to create the HeLa cell line, the misuse of her cells demonstrates the fact that medical advances cannot solely be credited to the scientists who do the research. Keeping this acknowledgement at the forefront continues to change how research is conducted. For instance, we encourage researchers to use the term participant or volunteers rather than subject to recognize the value of their contribution. Research cannot be done without study volunteers. We show respect for study participants when we keep them informed about the outcomes of the research they participated in. Community and patient engagement in research is another way to recognize that non-scientists also make valuable contributions to research in many ways. Now communities and patients are involved in developing some of the ideas for research based on their lived experiences. If you would like to learn more about Henrietta Lacks, please visit these links, which will also be posted in the chat box.